Hello, I'm Dan Hawkins, House Majority Leader of the Kansas House of Representatives, and this is a second series in a video with Beverly Gossage. You've heard her before. She is really, truly an expert in healthcare. In the last video, Beverly talked about HSAs, and HSAs, health savings accounts, are just a phenomenal thing for us to be able to use for healthcare. With the changes that she described, it'll be very good. But she talked about something that I wanted you to hear more about, and that is direct primary care, DPC. We call it DPC. And direct primary care is really what we used to call concierge medicine or membership medicine. Beverly, that's starting to take hold, and the federal government's starting to take notice.
All across the country. The American Association of Physicians and Surgeons, I speak at their conference every year. I just see that growing and growing every day. The Kansas City area, Wichita, Lawrence, some of the rural areas now. And the reason it's important is that the majority of your care you're going to get from a direct primary care physician.
Right.
They even dispense medications at cost.
Absolutely.
So, you know, $1 or $2 for medications, and some of the lab work at cost. So much of the care can take place right there. And yes, you mentioned HSA reform, to allow you to go to a direct primary care physician, pay for those monthly fees, I don't call them premiums, monthly fees, out of your HSA. That's part of HSA reform.
Absolutely.
It's very important that people know that, because what I keep hearing back to the Medicaid expansion thing is, but what about this population in health care? Okay, well, health care is available particularly to the low-income folks, and that is either they can pay for a direct primary care physician, but since these physicians do not work with any insurance companies, most of them don't take Medicare or Medicaid, they are not bound to not be able to do pro bono services.
Right.
Doctors who take those are told, if you give any pro bono services to a Medicare beneficiary, you're no longer allowed to accept Medicare payment. Same thing with a Blue Cross contract. So they can do some pro bono services, and they all do. If you come in and you explain that you're low income, they can take a certain percentage of their patients, do some pro bono services for you. Perfect. We also have charitable clinics that are available to people around the country. We've seen, especially in the Kansas City area, but elsewhere around the state, where doctors are already donating services to the charitable clinics and the charitable hospitals. So low-income folks can get services. That's just not true. It's not all about insurance and having an insurance card.
Well, we even have specialists now out there that are starting to take up the DPC form or model of practice. So even those are available. I think the DPC, the direct primary care, will become a huge part of our healthcare. I want people to understand that when these folks out there say, I just can't get access, that's wrong.
It is wrong.
Because they can. Maybe they just don't understand all of the things that are available to us, and DPC is going to be a big one. So, Beverly, thank you for being with us again today. Stay tuned. We'll do some more videos real soon. Thank you.